So we're here today in the Pueblo shelter because we're starting our first TNR, so trap-neuter-return, spay and neuter surgery. We're here with Dr. Arnold, our staff veterinarian, and we're going to find out a little bit more about the program and a little bit more about why TNR is such a crucial role in the Pueblo community. Here is our first patient. She's beautiful, though her eyes are open. She is sleeping, and that is, according to Dr. Arnold, the relaxed state of the eyes. So, Dr. Arnold, can you tell us a little bit more about what the spay and neuter surgeries entail and why they are important?
Like, you mean like the actual surgical process that I do?
Sure.
Oh, sure. I mean, it's just a small incision through the body wall, and then search out the uterus, which can be difficult sometimes, but usually in cats they're pretty easy to find. And then tie off the ovaries, tie off the uterus, and close them up. And then to the importance of it, especially when we're talking about animals that are sort of at large in the wild, we want to make sure that we don't have too much. Our big concern would be disease transmission. The overpopulation definitely contributes to that, can contribute to that disease transmission, because the more animals are out there, the easier it is to get passed back and forth.
So what drove you to shelter medicine? You said you worked in a lot of different settings.
Oh yeah, I grew up on a farm, and I also do large animal livestock veterinary work, but I really like the meaningful nature of this work, and it ties in actually really well with a lot of my knowledge of livestock and herd health dynamics, because that's a big part of what drives population dynamics in feral populations of cats or stray dogs. Just mostly the meaningful nature of the work, because since graduating from vet school, although I've enjoyed everything I've done, the most impact I've been able to make has been right here at this shelter. And I noticed that right as when I started doing relief work here, back in like 2017, I think that was, 2016, 2017.
When did you start officially at the Humane Society of the Pikes Peak region?
End of June this year, yeah.
What's your favorite part about working here?
The reason I applied, and still, yeah, my favorite part is the people I work with here. Everybody's just really driven to help these animals out, and I mean, personally, I enjoy their personalities and the fact that everybody's a hard worker and working towards this same goal, but you can really tell that comes from a place of compassion. So that's always nice to work with people who are passionate about what they're doing, especially in this business that can be extremely taxing and trying, because it can be difficult with the abuse and the neglect that we see in animals a lot of times. But at the same time, it can be just as rewarding on the other side when you help a sick or old animal to find a new and better home for themselves.
What's been your most heartwarming experience here at the shelter?
Probably that little dog Hondo. That was a really great example of both sides of like the heartache that can come along with this stuff, because he showed up again as a stray and was injured even worse than he had been before, and so this time we were able to keep him and get his eye fixed, get his leg fixed, and he, from one day to the next, we we had to remove his eye because of a bad corneal laceration. And he, from one day to the next, you could just tell that pain was gone. And he bounced back and was so happy and loving after. That was a great recent one.
Do you have any pets yourself?
Yeah. My wife and I have two dogs. One of them is really well behaved, and one of them is really, really friendly. So between the two of us, we have one good dog. And I have 11 pigs and about 30 chickens.
Wow.
Yeah.
And
like farming.
And what do you want the Pueblo community to know about the Humane Society, the Pikes Peak region?
I would really like people to know how much we do for the community, and that it's not just about adopting out happy little patients, although that is our goal, a big part of our goal. But we also have a big role to play in making sure that all animals, whether they're adoptable, healthy, unhealthy, or not, have a safe place to go.